everybody, welcome to another episode of the Digestion Diaries. I'm Dr. Jason Piken, and today what we're going to be talking about are hiatal hernias. I've discussed this in so many other videos I make, but I really don't believe I've really gotten into the nitty-gritty of hiatal hernias on a Digestion Diary video. So let me give you some explanation. First, why should you care about a hiatal hernia? What the heck is it? Well, if you've searched for this video, I know you've been searching for how to fix a hiatal hernia, but most people don't know why. So one of the big causes of acid reflux, GERD, heartburn, burping, belching, all in the upper digestive system is a hiatal hernia, it's called. And so let me give you my diagram that I use all the time. It's this right here. I'm going to try to stay off on the side so you can see it properly. So this, the thumb here, is going to represent your esophagus. So when you swallow food down your mouth and it starts to travel down this tube, that's called your esophagus. Let's put it right here because your stomach is going to be down here. So there's your stomach and esophagus. So you swallow the food, it goes down there, winds up in your stomach. It's separated, the esophagus and the stomach is separated by a sphincter, the lower esophageal sphincter. Don't worry about those words, really don't worry about them. What they're also separated by is a muscle called your diaphragm. Now, most people have heard of the diaphragm. It's a muscle that goes all the way front and back right through here, and most people associate the diaphragm with breathing. When you take a deep breath in, the diaphragm drops. When you exhale, the diaphragm pushes. Actually, taking a breath in is all about relaxing. That's all you have to do to take a breath in. It's the air literally falls into your body. Exhaling is where the effort comes in. Exhaling is where the diaphragm has to move up and push the air and help your lungs to squeeze out the extra air. And that happens all throughout the day, which is why we don't think of it. But the diaphragm also has another function, is it helps to separate the, let's see it clearly here, hopefully you can see it more clearly here. It separates that esophagus from your stomach. And if there's a weakness in this diaphragm muscle, it is one of the causes of a hiatal hernia, because what will happen is you'll have this little hole in the diaphragm. I know it doesn't look like the one from my fingers. It's closed on both sides, really. And that hole can get weakened because your diaphragm can get irritated. It's a muscle. It can get strained. And one of the causes is a subluxation in your neck, which is a misalignment, irritating the nerves in the neck. The third, fourth, and fifth neck bones actually send nerve innervation down to your diaphragm. It can also get irritated by you slouching, shifting like this, looking at your cell phone all day, working at your desk, just having bad posture in general. This cramps the function of your diaphragm, and it can make it more weak. Or just not exercising in general can actually make your diaphragm kind of lazy. And what we're going to do here is we're going to talk about what happens if in certain situations your diaphragm becomes weakened enough where the stomach, let me go back to this side, the stomach can slide up through the diaphragm, slide up through that hole, and it herniates through. So you have this herniation of the stomach going up through the diaphragm. I think I've said that in enough ways where you can understand it. That is a very common cause of acid reflux, because now the acid that's supposed to be in your stomach, our stomach is extraordinarily an acidic environment. It has hydrochloric acid in there because we need to break down our foods, and the acids help to break it down, but those acids should stay in the stomach. So I'm not going to get into this video why you shouldn't take antacids, because even though they make you feel better, they're going to ruin your ability to digest certain foods. That's all I'm going to mention. Save it for another video. What we're going to talk about is a structural problem here, the hiatal hernia. So let's say that stomach has slid up through the diaphragm. Now the acid that's supposed to be in your stomach is escaping because that pinch that's created in the lower esophagus and the upper, sorry, not the lower esophagus, the upper part of the stomach is allowing that acid to escape through that lower esophageal sphincter. There are other videos, and I just want to give you my opinion on how to correct a sliding hiatal hernia, one that slides up and down. You can work on yourself. So here's the gist of it. Ultimately, you want to have a doctor do this, somebody that's trained in doing this. And there are certain situations where you may need a GI doctor to evaluate you. You may even need a surgery. There are surgeries that can actually fix that hernia, and sometimes we need to go that far because it's so severe and it's causing so much acid irritation. So always check with any doctor, whether it's your chiropractor that knows how to do this, the applied kinesiologist, that's myself that I talk about, or your GI doctor. Get an opinion. Yet if you know you've had that hiatal hernia diagnosed, you want to work on yourself just to try it. Here's what you do. The diaphragm you can feel this way. You start with the center of your chest. There's a breastbone there, okay? Ribs, breastbone. It's called your sternum. You're just gonna slide down with fingers that look like this, just crooked fingers. You're gonna slide down, and then you're gonna feel that it comes into a depression. All of a sudden it gets soft. Bone, stomach, okay? You're gonna go just a tiny little bit to the left, okay? Just a little bit to the left, and you're gonna feel your rib there, and that's an access point to your diaphragm. Now, if you feel a sore, tender point there, well, first, rub that a little bit. Start massaging it, because if you release the tenderness and the tension in that diaphragm, the hiatal hernia just might relax and release on its own. If you want to try a little bit more relief, what you can add to is this. You take those, again, those crooked fingers, you find that soft spot, just go a little off to the left. You take a deep breath in, which allows the diaphragm to move down. You exhale, and what you're doing is you're actually pulling on the top of your stomach while the diaphragm is going up during your exhale. So you breathe in, exhale, and push down. And I move down. I'm going to show you closer. If this is the bone, this is where it gets soft right here. I'm going to move just to the left about an inch. I feel a tiny tender point there. I can rub that. Just below that, I'm going to take those crooked fingers, breathe in, exhale. My diaphragm has now gone up, and I'm going to push down. Push down while you're exhaling, and that's it. And you can repeat this about 10 times. You can even do lightly. You don't have to cause enough pressure where you're gonna create a black and blue. You just wanna go in there, pull down lightly. I've also done it this way, taking my thumbs, pushing down. And it just feels good actually to do that on myself, because I have a hiatal hernia that comes back occasionally, and I'll tell you, just recently it returned for a few weeks, and between my wonderful chiropractor, Dr. Bland, if you're watching this, great, he helped me a lot with his technique of doing the hiatal hernia move, and I worked on myself, and it needed, some people only need 1 or 2 or 3 releases. Some people are chronic and they're gonna need to release it over and over again. Some people need like 10, 15, 20 releases. So you can either come to my office and I can start working on this diaphragm move, or you can work on it yourself and see how things go. Now, if your symptoms don't resolve, you should seek medical attention. That's just common sense, but I know I have to say this because not everybody has common sense. If you keep having persistent burping, belching, reflux, heartburn, and you think, or you've been told that you have a hiatal hernia, and you've tried these moves, and you tried to go to chiropractors that, or acupuncturists or physical therapists, whoever it is, that have tried to fix it for you and it's not resolving, seek more opinions. You don't want to mess around with a symptom that's not going away. So that's the whole idea of the hiatal hernia move. I hope everybody gets some information out of this. Remember, my goal is not to treat a disease. It's to help find a trick, a movement that is therapeutic for your body so you can feel better, yet It's not the treatment of disease, it's getting to the cause, which is a malfunction in the diaphragm muscle. You can treat a muscle, we're not treating reflux. Hope that helps. Have yourself a great day. Ask all the questions you want below.